Leptospirosis is a bacterial infection that can affect both humans and dogs. It is considered the #1 emerging zoonotic threat worldwide. Leptospirosis is a zoonotic disease. What zoonosis means, it's a disease that we can contract, that humans can contract from animals. And leptospirosis is considered the #1 zoonotic disease in the world. Unvaccinated dogs will contract leptospirosis through standing water or contaminated soil from other wild animals, other dogs, farm animals, lapping in a puddle, swimming in a pond, playing in a creek. That's the way they'll contract it. We used to just consider it to be a rural problem, dogs that live out mainly in country areas. We're now finding it's moved. It's now more an urban problem. We're seeing it in the smaller dog breeds that live in the high rises, in the condominium complexes, in the apartment complexes. It's now a downtown dog disease as well. So it's everywhere. Once a dog has contracted leptospirosis, the incubation period before they show clinical signs is anywhere from 1 week, sometimes up to 4 weeks. The problem is these dogs, in the meantime, are shedding the bacteria into their environment and creating a source of infection or exposure to the human family. Clinical signs of leptospirosis are very vague. In humans, it's flu-like symptoms. In dogs, we see signs of lethargy, inappetence, vomiting, diarrhea, and often it will lead to acute renal failure, liver failure, all very, very vague symptoms in the early stages, so that by the time a diagnosis is made, it's often too late for these patients. When I have a critically ill patient that has leptospirosis, it always reminds me that this disease is salient. It's there. We just tend not to see it until it's too late. And it's then I wish that I had some way to warn my clients of just the dangers of it before I end up with an active case in my clinic. Pet Disease Alerts is the only way you can stay up to date with diseases that are potentially affecting your pet and your family. It's incredibly easy. You just go to Pet Disease Alerts, you set up your own account, you choose the counties in your area, and every month it sends you an alert to the activity going on in your county. It's a great way to be able to stay informed so you can better protect your pet and thereby protect your family. So what do you do if you get an alert? Well, the first thing you should do is contact your local veterinarian. They're the local expert. They understand these diseases. They'll be able to look at your pet's history, make sure that they're up to date, or see if they need to be vaccinated. And then they'll be able to advise you on what other additional steps you can do to further protect your pet and your family. The good news is there's vaccinations available against leptospirosis now. Talk to your veterinarian. We start puppies in the series, and then we give boosters to adults as well. So it's a very important conversation to have with your family vet.